Hi guys, I'd like to speak to you today about a new exciting product that's been developed by Invisalign and with the help of several orthodontics here in Vancouver actually, and it allows me to use Invisalign type appliances to treat my younger patients. As many of you know, I like to treat kids if they have significant problems in two phases, with the first phase happening around about 7 or 8, where we can usually do things like widen the jaws or fix sticking out front teeth relatively easily at that age, and then have the kids sleep with some retainers, and then when they're teenagers we only have to do a little bit of tidying up. All the heavy lifting sort of being done when they were younger, more amenable to treatment, and everything's more flexible. So with that in mind, I'll show you a couple of the appliances that we would traditionally use to do that, and then I'll show you how the new Invisalign product called Invisalign First, how that helps replace all of this stuff I've got in front of me here. So for example, if we want to widen someone's upper jaw, we would use a device like this, which has got 4 braces, a little piece of plastic in here with a screw mechanism, and then once this has been made and placed, as you can see it's quite bulky, then the parents put a little key in this mechanism here, and they have to turn the mechanism twice a day for about 2 weeks to widen up the jaw. And parents frequently find getting the key in the little mechanism they're quite difficult because obviously this device is in their child's mouth, and when they have to do it, so they have to become a bit of a dental assistant for a few weeks. So that's how we do the widening. That usually involves having a few braces on the front teeth as well. So once we've done the widening, we can shuffle the teeth around to start making them look straighter and fit them into the correct position. If we have a patient who's got what we call overjet, where the front teeth stick out like that, then we usually use appliances like this called twin blocks, where when you bite together the plastic gets in the way, and it sort of teaches you to bite forward into that new position, and as the child is growing they'll grow to fit that position, and so at the end of about a year or so their front teeth aren't sticking out anymore. These devices frequently have screw mechanisms built into them also, and the same sort of problems can exist with getting parents to turn the screw mechanism. And as you can see, these are quite bulky appliances as well, and these patients frequently have a few braces as well. So there's quite a bit of stuff going on in their mouths. So with the new Invisalign product called Invisalign Teen, we replace all of that with an upper and lower set of aligners like this, and the aligners in some cases have these little wings built onto the side. So the first thing the aligners do is to gently widen the jaw so that we don't have to use that screw mechanism, and these incrementally widen the jaw by the patients changing up for a new aligner every week, and each one's slightly wider than the one before, and they're strong enough to do the same as those mechanisms we showed you previously. So that's really great, because this now means there's a lot less stuff in the patient's mouth. Parents don't have to fiddle around with the screw mechanism, and there's really nothing to break or get stick in their cheeks or lips or stuff. It's all a lot simpler and easier on the kids. These little wings that you can maybe see here, if someone's front teeth is sticking out, and we normally use the twin blocks, the plastic devices I showed you previously, these little wings here make it so that as the child bites, the lower jaw is guided into its correct place, just like the twin blocks would do. But as you can see, there's a lot less bulk, and these little things are just sitting in the cheek, so they don't bug the kids at all. And so we have several patients now that we're under treatment with this new mechanism, and those patients are finding it a much easier go than this. And in fact, it's proving especially useful also in some of my patients who have various challenges, in that and this is a much easier system for them to adapt to than all of this other sort of old school stuff that we used in the recent past. So anyway, just thought I'd bring you up to date on this new exciting development from Invisalign. I'm really excited about it, and it's proving to be a great asset to our patients. Okay, bye guys.